Physician assistant education is very similar to medical student education. Physician assistants usually come in with more clinical experience than medical students do. Physician assistants learn the same kind of curriculum that medical students do, often right next to them. And I've found in the research that I've done that the physician assistant students have done just as well as medical students, in some cases better than some of our resident physicians. And their background and their quality of work has been really impressive.
There is not a limit to the types of conditions that I see, that I've been able to diagnose and treat, order laboratory testing for. A big part of my position is the surgery, actually, and doing those minor in-office procedures that would otherwise tie my supervising physician up.
I hope and I think that patients should feel comfortable with seeing a physician assistant, knowing that we're educated very well in the medical school model, that they're able to see us a little quicker potentially than they would be to see the dermatologist, but also feel confident that they could contact their supervising physician so that the patient would feel comfortable that they're getting the absolute best care possible.
In our practice, we literally work side by side. We work as teams. We have our own independent schedules, but we're all in the same hallway and we all share the same lab. In my 20 plus years of working with PAs in the dermatology office, I have found that for me individually, that's the best way to work with the PA. And I think the patients enjoy it.
Come on, you've heard about it. Maybe you've had friends who've gotten treated with it. Isn't it time to ask your doctor about Botox cosmetic? Before considering any aesthetic procedure, you probably want to get your questions answered. Questions like, what exactly are those moderate to severe frown lines? We call those moderate to severe frown lines between the brows a 1, or an 11, or a 111. Which one are you? Years of squinting, concentrating, or frowning can cause your skin to furrow and crease. As time passes, your skin becomes less elastic and those moderate to severe frown lines remain, even when your muscles aren't contracting.
I've sacrificed a lot over the years, and that's why it's time to do something for myself. I'd like to make these moderate frown lines between my brows less noticeable.
Ask your doctor if Botox cosmetic is the one for your ones. With a few tiny injections, Botox cosmetic blocks nerve impulses to the injected muscles, reducing their contractions. This reduced muscle activity helps reduce the appearance of moderate to severe frown lines between the brows.
It was only about 10 or 15 minutes. There was little discomfort, and when I was done, I actually could not believe that it was over.
I did notice a bit of a softening of the lines, and over time that's just increased more and more.
In clinical trials, 8 out of 10 women achieved clinically significant results at day 30 with Botox cosmetic. In a survey of 293 patients, most were satisfied with results of their Botox cosmetic treatment. Visible results have been shown to last up to 4 months. Remember, you and the faces you saw today are unique. There's only one Botox cosmetic.
The lines that I had here on my face prior to Restylane were deep, and I honestly didn't know what could be done about them. I hated the way they looked, and ever since I've had the treatment with the Restylane, you know, right over here on my face, they're gone. I look much younger. I wanted to show off my new look to everybody, everybody from family to friends. I've had many compliments, and recently I've ran into some friends who I haven't seen in a long time, and the first thing they said was, "You look amazing," and of course they couldn't quite figure out what was different. My greatest concern before having any Restylane treatments was probably pain or an unnatural look. After my treatment, I was able to resume normal activities. As a matter of fact, I asked the doctor if I could work out later that day, and he said absolutely. And that's what I did.
The VI Peel is a revolutionary product that has helped hundreds of thousands of people get rid of their acne, reverse the signs of aging, repair sun damage, and treat hyperpigmentation, including melasma.
It can address a number of different skin issues in one application. We use it for acne as well as discoloration left by acne. We use it for fine lines, and we also use it for discoloration from the sun.
Our peels are suitable for all Fitzpatrick types, and they're safe for the face and the body. Unlike other chemical peels, our treatments are painless, require no skin preconditioning, and have minimal downtimes. Our treatments are practical, affordable, and give excellent results within 1 week.
This product works when they come into my office. They know they're getting a good product, something that will really peel their skin and then give them the kind of look that they want.
We enjoy having it, our patients love it, so overall people are very pleased with this peel.
PCA Skin is a true pioneer in the area of chemical exfoliation. Our peels are considered the gold standard within the industry, and we are acknowledged in numerous prominent medical textbooks as being the originator of the modified and enhanced Jesner's peel. We continue to lead the way within our industry by providing gentle and highly effective chemical peels. Because every patient is a unique combination of their DNA, environment, and lifestyle choices, it's important that you have numerous different treatment options. PCA Skin currently offers 14 different treatments and countless ways of customizing them for the individual patient. Our peels are unique in that they are not neutralized, are not washed off, and are not timed. PCA chemical peels are special because they are self-neutralizing and are left on the skin.
Prior to using the PCA peels and the products, I was kind of miserable in terms of my face. I have tried everything, nothing worked, and this actually worked. I've recommended it to everybody that will talk to me about it. I think it's something for everybody. I mean, I think everybody has problem areas with their skin. No matter what age you are, it seems like everybody has something.
It works, and I would say, you know, give it a try, because how you're feeling now can change.
I do feel better because my skin looks better, so I'm carrying myself better. It's more of a confidence thing. I think I hold my head a little higher because I look better than I used to.
I have gotten compliments and people have been seeing improvements, that my face does look a lot better. You know, your face looks fantastic. What are you doing? Looks great.
You get like a glowy look, and then within a couple of days I see the skin just looked and felt tighter. With Pelave, what I like about the eyes is that There really aren't much injectables that you can put in there, and this took away the circles under my eyes, and it made them, the wrinkles have gone away. I actually just had lunch with a girlfriend who hasn't seen me in a while. She's like, "You look so young. What have you been doing?" And I said, I haven't been injecting.
I went to my dermatologist after I had a baby, and my skin looked pretty tired and just needed something, I thought, at that point to freshen up my look, and he recommended the Pelave. It was pretty immediate. It's a little, my skin was a little red when I walked out, but nothing noticeable. I went back to work. I noticed the skin tightening right away, and and kept tightening. You could see kind of the look of it. Definitely looked softer, which is what I was going for. I had some fine lines around the eyes, and so the goal was to soften it up a little bit.
I've been using Pelave in my office for about 6 months now. Not only do I like it, my patients love it. Pelave is extremely easy to use. It is simple. There's no anesthesia involved. Local. The gel is applied to the face. Patient is very comfortable during the procedure. It's a relatively quick procedure, about 20-30 minutes. I have used it on the forehead, around the eyes, and the cheeks, even in the jowls. It's very well tolerated by the patient, completely painless. Pelave, the generator, is an extremely portable device. It's a tabletop model that is very convenient, and it can be relocated with great ease. Pelave is extremely easy to use. Gel is applied to the skin surface. The machine is turned on, the patient has to be grounded, and the process begins. Very well tolerated by the patient. There's a little bit of warmth that's generated. The patient can put makeup on it right away and be on their way. The skin will feel a little bit tighter. The pores will shrink. The fine lines will get better. They get this sort of a beautiful glow to their appearance post-treatment, both immediately and also long-term as the collagen gets built up. Patients seem to love it. They love the feel right immediately after Pelave, and they also like the long-term effect that they get with Pelave.